Washington.
We need better regulation at the state and at the federal level over technologies that are known to be discriminatory, that are likely to be discriminatory, and that have very specific direct impact on people's lives, people's health, and people's freedom.
Are you worried about your kids' safety on the internet? We are here to help. Washington's 5-step checklist will take you through the process of protecting your kids, and will give you tips on how to set up the best parental controls for your children on their devices. You want what's best for your children. They deserve to be safe online. Our step-by-step guide will help you make sure they are. Download Washington's online safety checklist today to protect your kids online. Find it at protectyourkids.online. That's protectyourkids.online.
Welcome to the Tech Policy Leaders Podcast.
The world's most influential voices keeping you safe and informed online.
Streaming from Washington, D.C., America's tech law and policy epicenter. These are your leaders. This is the podcast.
Tech Policy Leaders with Joe Miller, founder and CEO of Washington.
Washington, safe and informed since 2014.
My guest today is Lydia X. Brown, Policy Counsel with CDT's Privacy and Data Project, focused on disability rights and algorithmic fairness and justice. Their work has investigated algorithmic harm and injustice in public benefits determinations, hiring algorithms and algorithmic surveillance that disproportionately impact disabled people, particularly multiply marginalized disabled people. Lydia X. Brown.
Thank you so much for having me.
So, tell us about your career journey and what led you to CDT.
My background is in disability rights and disability justice. I've been a community organizer and policy advocate for about 15 years working in that space. And I came to CDT after I had decided to become involved with Georgetown Law's Institute for Tech Law and Policy, which was pioneering a first-of-its-kind project focused on algorithmic discrimination affecting people with disabilities. And in joining that project to help lead research and advocacy around AI bias and discrimination affecting disabled people, that helped me learn that there's an entire world of technology policy advocacy and research that touches on issues affecting disabled people's lives, our health, our freedom, or access to the community, and not enough people in either technology or disability spaces understand the deep and urgent connections.
And that's why I wanted to bring you on the show to talk about an issue specifically that isn't discussed in the mainstream media anywhere near as often as it should be, and that's the issue around ableism and disability discrimination in the context of surveillance. And you and your co-authors, Riddhi Shetty, Matt Schrerer, and Andrew Crawford, write about how this operates in 4 different contexts: education, criminal legal system, healthcare, and the workplace. Tell us about your paper.
This paper is also a first of its kind, and I feel like that's going to be a bit of a common theme here. And it was the first policy brief explicitly addressing the impact of new surveillance tech, especially automated surveillance technologies, and their effect on disabled people. There's been a lot of research and advocacy focusing on the impact of surveillance tech on communities of color, especially in Black and Brown communities, and especially in immigrant of color communities. And there's also been a fair amount of work addressing the impact of surveillance tech on specific communities, like people who are homeless or low income, people who might do sex work and other criminalized labor, people in the LGBTQ community, for example, but no wide-ranging, comprehensive report addressing the impact on disabled people, and especially disabled people who belong to all of these other marginalized communities as well. This report tackles the topic of surveillance tech in 4 different areas: in the educational context, in employment, in healthcare and health-related contexts, and in the criminal legal system, particularly as a force expanding and perpetuating mass criminalization and mass incarceration.
What are you seeing in the context of education happening here?
There are a number of ways in which schools at both the K-12 level and institutions of higher ed are deploying surveillance technologies on their campuses and in their students' lives. Two of the areas that we look at in the report are, broadly spoken, the use of automated remote proctoring technology, which is used for tests in all grade levels and in higher education and in licensing examinations like the bar exam that lawyers have to take to be able to practice law. And the use of surveillance technologies that are purportedly for the purpose of promoting public safety, dealing with violence in schools, preventing a mass shooting at a school, and those kinds of supposed violence prevention tactics. The first of those categories of automated remote proctoring are technologies that essentially rely upon assumptions about how people take tests, how they move, how they interact with their technology, their devices, how people function in a test-taking room, and what resources someone has access to. Assumptions that disproportionately disadvantage or even lead to outright suspicion and surveillance of disabled people and other marginalized people. For example, students who are lower income and do not have access to a private, quiet location in which to take their test. Or, as has been well documented, darker-skinned students of color whose faces may not be adequately detected by automated proctoring software that seeks to identify the test taker. And for students with disabilities, with a range of disabilities, test-taking software presumes that you do not have Tourette's or ADD, that you are not blind, you do not have cerebral palsy, you do not require the services of a service animal or a personal care attendant, that your eyes are always looking directly at a particular camera, that you only have to use the bathroom sparsely. All of these assumptions that do not hold water when applied to disabled test takers, many of whom have experienced their test-taking session being automatically terminated or subjected to additional scrutiny and review because the software flagged them as possibly cheating just for existing in the exam room. The problem with those programs, of course, is that they operate by design on the assumption that anyone who is outside the norm of a very narrow range of parameters is suspicious automatically. And disabled people, by definition, exist outside the norm.
That's wild. And not to mention if they haven't even been diagnosed.
Right. Or if a student does have a professional diagnosis, but they don't feel comfortable disclosing that for a variety of reasons to their school or to the test administration.
Mm-hmm. Yeah. Which is sort of ironic because they're not disclosing it to avoid the bias that they're being subjected to anyway. So what about the criminal justice system? What are you seeing there?
In the criminal legal system, which is a term that I also use very deliberately, I don't say criminal justice because that would imply that the system is about justice or promotes justice, and it's not. And I think we should be really clear about that. But the criminal legal system, technologies that we see in that space mirror some of the same ones that are ostensibly aimed at promoting quote unquote public safety in the educational context. And those include a range of predictive policing technologies, as well as technologies that purport to be able to detect and respond to violence, whether that's content monitoring or whether that is software programs like in schools, aggression detection microphones, or automatic license plate readers that could be used by a school to surveil their parking lot or widely used by state authorities to surveil their highways or roads within cities. And in the context of predictive policing tools, a range of software programs and predictive analytics type practices that seek to allocate police resources either to specific geographic locations or to target specific individual people based upon assumptions about who is likely to engage in crime, where crime is likely to occur, and what kinds of crime, which again is a very broad, nebulous concept, what kinds of crimes should be targeted for surveillance and for enforcement. And these kinds of technologies, too, are notoriously unreliable. And more than that, when they do work as intended, They work by reinforcing, entrenching, and exacerbating existing forms of prejudice, discrimination, and bias. If a predictive policing tool, for example, is allocating police resources to a location within a certain jurisdiction where more arrests have been made and more people have been stopped, well, if the police were stopping a whole lot of Black and brown people in one particular neighborhood, then that's going to be the same neighborhood that they're going to keep being sent back to, because biased data going in is going to result in biased data coming out. And we know that in the context of disability, the disabled people have significantly higher likelihood of encountering police. Developmentally disabled people are at least 7 times more likely to encounter police than non-disabled people are. Disabled people are more likely to be victimized by violence in a range of forms. We know that disabled people constitute anywhere from 50 to 80% of all people who are incarcerated. And the Department of Justice even admits that 85% of incarcerated youth have one or more disability. That's at least 85% that the Department of Justice itself admits. And so when you have predictive policing tools that are looking at what locations and what people should be targeted for police intervention and surveillance and investigation and enforcement activities, they're going to send police resources right back to the same communities and the same people that already disproportionately experience heightened scrutiny and surveillance, which in turn leads to biased feedback, creating higher rates of arrests and prosecutions, convictions, and rates of incarceration.
You're plugged into the Washington Tech Policy Podcast, the inclusive voice of tech policy.
What about the disability as far as mental health issues would be concerned, and kind of trying to predict who is kind of in a state of mind that makes them more, that might make them more susceptible to violence, and if they're in the vicinity, trying to control for that?
It is notoriously unreliable to try to predict who actually has a diagnosis of a mental health disability or not, although researchers are trying, and frankly, it's terrifying. But even so, we know that people with mental illnesses are not any more likely on average than people who are not mentally ill to engage in acts of violence. And when we do, there are usually numerous factors as to why someone is engaging in an act of violence, just as with someone who does not have a mental illness at all. And unfortunately, surveillance technologies in the health sphere and the criminal legal sphere that are attempting to better and more accurately identify or predict mental illness or diagnoses of mental health disabilities are only going to lead to further criminalization and profiling without addressing any of the root causes of violence at all. The root causes of gun violence and mass shootings are not mental illness or untreated mental illness, as most people will talk about it, but rather a culture of violence in our society. A fact that our government itself routinely engages in violence that we don't consider or count as violence, like a huge amount of shooting deaths and gun violence is actually carried out by the police. But that's not usually how the statistics are collected and how most people talk about them. And this leads to really dangerous scapegoating that in the same way as people from minoritized religious groups, particularly Jewish and Muslim people, as well as people of color and immigrants and refugees, especially from communities of color, are so often scapegoated as likely criminals, as likely violent actors, as dangerous, as scary. The same thing is happening and has been happening for many decades for disabled people, and specifically for people with mental illnesses or psychosocial disabilities and people with developmental disabilities. And I experienced that firsthand. When I was in high school, I was falsely accused of planning a school shooting. And that was absolutely because of racial, gender, and disability discrimination.
What the fuck?
Yeah, what the fuck is the only appropriate reaction to that.
So now let's let's turn to healthcare. How does ableism play out in healthcare?
Oh man, you could have asked a better question is how does ableism not play out in healthcare? Because it is everywhere. Our entire healthcare system is profoundly ableist in its structure and who is supported in becoming a medical professional, in the monopolization of medical expertise over the lives of people with disabilities, and in the ways in which disabled people are continually subjected to discriminatory and prejudicial treatment in all aspects of our healthcare system. Even just looking at the impact of COVID-19 and attendant care rationing and triage policies that revealed what we already knew in the disability community, that many healthcare systems and professionals already devalue disabled people's lives and assume that our lives are not worth living and certainly not worth saving and not worth protecting. The surveillance technologies that we've looked at in the health context include, for example, a range of technologies and devices that collect data on what someone who is using a particular technology or taking a medication is doing in the context of their treatment. Data that should be protected under our existing HIPAA law, but which could still lead to discriminatory treatment in the healthcare setting, could chill people's ability to seek out healthcare for fear of discriminatory treatment or of greater surveillance from medical professionals. And going back to the same conversation we were just having, lead to further calls from policymakers and from political pundits to share an increasing amount of health information, especially mental health information, with law enforcement. Again, putatively to stop violence, but in reality, further scapegoat and harm vulnerable people. Mm-hmm. Without actually stopping violence.
Yeah. That's scary. And what about the workplace? What are you seeing there? I mean, I can take a wild guess, and it's probably true.
What's your wild guess? Now I want to hear.
No, I mean that the employers are selling data.
Oh,
and or giving it to law enforcement for nefarious purposes, or with these constant surveillance of folks, every second is managed and surveilling how long their breaks are and so forth. What am I missing?
You're not missing much. My colleague Matt wrote an excellent report that also came out last year. Okay, edit that out of the podcast. My colleague Matt Scher also wrote a really fantastic report about the rise of bossware, which is surveillance tech at work. And that includes what you just described, Amazon surveilling their workers every second, but it also includes workers in a wide range of sectors and job functions, blue collar work and white collar work, workers who go to an office, workers who are remote from home, workers who are out in their community because they're doing delivery work, and workers who are on site somewhere like a warehouse, who are all subjected to an increasing amount of more sophisticated and invasive surveillance technologies collecting data on their work, on how they do their work, on how they function, on where they are, using any number of sensors, microphones, and cameras on their devices to do it. And that employers too are tapped into an ecosystem of data collection that can have really dangerous implications. Like another thing that we talked about in this report on surveillance tech is that employers also are increasingly sponsoring wellness programs. This has been a trend for the last couple of decades, some of which now come with apps or other software to track health and wellness related goals for their employees. But even where those programs or participation in them is technically voluntary, you know that there's a big power differential between a worker and their employer, and it may not feel like it's a meaningful choice. And workers don't have much control, of any, over who holds the data that is collected on them in their participation in those programs and where that data is going. So for a range of reasons, our working life is also not a place where people can feel safe or private anymore.
Yeah. And and people are entering the workforce and they're used to it. So they don't have a frame of reference of knowing what it was like before. So now, what are your conclusions from this, and what are your recommendations some final thoughts and where we can find you online to stay on top of these issues.
We don't have a strong enough set of regulations now. We have patchwork regulation that applies in bits and pieces to different ways in which technology might be used in people's lives. And we need better. To learn more about the work that I'm doing and what CDT is advocating for, you can visit our website at cdt.org, where you can read this report, and you can also read it in plain language, and you can read our other work and about our advocacy. You can also read more about me and my work as a disability advocate at lydiaxzbrown.com.
Lydia X. Brown is with CDT, where they serve as policy counsel of the Privacy and Data Project. Lydia, thanks for joining me.
Thank you again for having me. It has been a pleasure.
Washington Tech.